There's a cruel paradox. We're massively overtreating basically healthy people who don't need it. At the very same time, we're undertreating, shamefully neglecting people who desperately do. Big part of the problem with drug companies. They've been able to sell the idea that mental disorder is underdiagnosed, that it's easily diagnosed, that it's due to a chemical imbalance, and that the best treatment is always a chemical treatment for a chemical imbalance. This is nonsense, but it's taken hold. How do we know this? 20% of the population in the United States takes psychiatric medication every single day. 6% are addicted. We now have more overdoses from psychiatric drugs than we do from street drugs. It's especially problematic with kids. 6% of our kids are getting stimulants for ADD. 10% of teenage boys are being treated with stimulants for ADD. 4% of teenagers are on antidepressants. And many kids are being treated with antipsychotics that they don't need. It's especially a problem in nursing homes. People who have trouble getting a staff member to take them to the bathroom and are agitated because of that are given antipsychotic drugs which are unnecessary and will shorten their life expectancy. We shouldn't be solving school problems by calling the kids attention deficit disorder. We shouldn't be solving nursing home staffing deficiencies by saying that the people need an antipsychotic medication. 80% of these medicines are prescribed by primary care doctors. Usually, this is done after a 7-minute evaluation. The doctor doesn't know the patient very well, has been very much influenced by the drug company salespeople, doesn't have a particular expertise or interest in psychiatry. In this situation of massive overtreatment, it's very important that patients and parents protect themselves, protect their kids from what may be unnecessary and potentially quite harmful medication. How to do this? Become well informed. Don't accept a quick diagnosis. Don't accept a quick prescription. Always ask questions. You should never go to a doctor without having 3 or 4 questions right on the tip of your tongue or written on a paper. And if you don't get common sense answers, don't buy the diagnosis, don't buy the treatment recommendation. Get a second opinion. It's very easy to give a diagnosis. It's very hard to get rid of one. A good diagnosis can be the beginning of a much better future. An inaccurate diagnosis can cause endless problems. There should be as much care in a psychiatric diagnosis and in the beginning of treatment as if you were buying a house, buying a car, even meeting someone and having an important relationship. It's important that you protect yourself from overdiagnosis and overtreatment, and even more important that you protect your kids. On the other hand, severe problems, impairing problems, persisting problems, these often do require medication. And so you shouldn't feel that medication's all good or all bad. Medication that's wonderful for the few can be very problematic when it's given to the too many. So you have to learn a lot and trust your own instincts and get second opinions. I hope this advice is helpful to you. Thanks very much.